It is great to be with you today. We are so fortunate on the podcast today to have with us clinical psychologist, psychedelic therapist, co-founder of the Sequoia Center, on the Training Subcommittee for the Oregon Psilocybin Advisory Board, Dr. Alissa Bazinet. She's going to be sharing with us from her expertise about what's going on with psilocybin and psychedelics, particularly in the state of Oregon. Great to be with you.
Thanks, great Marty. To have you here with us, Alissa. And we know that you are in the forefront as much as you can because we are in the first state, right? And you were involved. I remember a few months ago, me and Marty, we were listening to you talk to whole bunch of people about what you were going through, all the challenges that all of you had, and especially the subcommittee, because one of the things that you're responsible for is the trainings, right? I mean, how do we train? Yes. In what do we train? So I remember thinking, wow, that is a huge challenge because you're the first. So can you just start there, talking briefly about the challenges that all of you encountered being the first?
Sure. Yes, so you have it correct. We are the first state in the country to create a legal regulatory system for psilocybin specifically. And so it's really quite an idealistic measure that was passed. And it's been an exciting, fun, and complicated challenge to put together the rules and regulations that will govern this program because it's never been done before. But I do want to start with saying how inspiring I find the process has been on one level, because it's really a measure that attempts to create structure for a lot of different settings where psilocybin could be used. So think about, we hear a lot about psilocybin-assisted therapy and sort of a psychotherapy model, but there's also religious and ceremonial use. There's folks that want to use psilocybin more for spiritual growth or wellness, general personal development. And the ideal behind this measure was that we would create a system that could meet all of those needs. So on the one hand, that's really beautiful.
Wow, right there I'm going, that is too much.
Right. And, I do find, I haven't lived in Oregon all of my life, but I've been here about 10 years in Portland specifically. And I do feel that that is a value that a lot of Oregonians and specifically Portlanders share, is this sort of progressive idealism, really wanting to be creative and make the world a better place, wanting to create access for folks who don't have access to these services and these medicines. As you probably know, Oregon has a pretty major mental health issue in that a lot of folks are struggling with mental health symptoms in Oregon, and with the passing of 110 as well, Measure 110, really we're also attempting to set up a system for people to access recovery services more readily than they have before, rather than getting punished and going to jail for using substances. Instead, there's a whole treatment system that's being set up. So lots going on, but back to 109. So the idealism. With that comes great challenge of trying to create rules and regulations that are applicable for all of those settings. And so I think that that's, been the work in the subcommittees, and I'm specifically in the training subcommittee, and there's so much going on and the other ones as well. I can't keep up with each of them and what's happening, but I can speak to the training. And so go ahead, Mark.
Go ahead. I was just going to say, for our podcast listeners, if you don't know when she says 109, that's the November 2020 Measure 109 in the state of Oregon that was passed, that's allowing for the legalized use of psilocybin. So 109 is that code language in Oregon, November 2020, the measure that is allowing for this to move forward legally. So yes.
Yeah, and legally it will be part of our lives in 2023, right?
Yes, that's correct. So 2023 will be the date when people can apply to become a licensed psilocybin facilitator or a licensed psilocybin site, so services site. So all of the services must take place at a licensed site. And then there will also be licenses for manufacturing as well in 2023 to manufacture.
Okay, so three different types of licenses.
That's right.
Okay. Yeah, Oh, sorry. So can we talk about the training? We were talking, Marty and I, this weekend, and we actually he received an email from one of the universities here in Portland already presenting themselves as an institution that will give that kind of training. First question is, what are the requirements? Who can take those trainings? Because I know that was a big question at the time, right? Does it have to be a mental health professional? Can anyone do it? But so where are we?
That's right. So the Measure 109 states that the only requirements that somebody has to have is to have a high school diploma or a GED, to be 21 years of age or older, to have lived in Oregon for at least 2 years at the time of application, and to complete an approved training program that will be approved by the Oregon Health Authority. And so that program, that's what I've been involved in, kind of coming up with suggestions for the rules and regulations that will govern the content that needs to be in that program. And so people who want to apply to become a psilocybin facilitator will complete that program and then pass a state licensing exam, and then they can be licensed as a psilocybin facilitator. Okay. So those are the general requirements. That's what we know so far, and that has not changed since the measure was passed.
Mm-hmm. And for our audience to know, you kind of have your foot in two camps, if I'm not mistaken. You'll have to qualify. On the one hand, you are serving the Oregon legislature and the people of Oregon and the state of Oregon by figuring out what the rules and the practices and participation looks like. But at the same time, you also have your foot in the camp of potentially being a faculty member who teaches people in the Lewis and Clark College, happens to be the university that has this program being developed. So is that correct, that you sort of have your foot in both camps? You're going to be a faculty trainer, but you also are helping shape the laws and the governance as well?
Yes, that is correct. And in fact, there's a third camp in that I hope to open a psilocybin services site. I currently have a nonprofit working with folks with ketamine-assisted psychotherapy and want to be able to fold in psilocybin services as well. That remains to be determined how that will all play out. But yes, so you're hitting a really important point that has been brought up a lot recently, which is that a lot of folks who are serving on these committees and are part of the Oregon Psilocybin Advisory Board also have other interests, right? They have businesses they may want to develop in the psilocybin industry, or they're therapists or they're trainers, right? And so this is something that has been actively discussed in recent weeks because it's, it creates an interesting environment that folks have a lot of interests. And I will say, first and foremost, for me, I'm really interested as a clinical psychologist. I have a particular bias in really wanting to provide services that are safe and accessible for folks who do have severe mental health issues. And sometimes that can be a little bit more complex to think of what those folks need. I'm thinking of the folks that I have worked with in my practice. I used to be at the VA hospital working with veterans. So I think about them a lot. And, what is it that they're going to need in the rules and regulations in order to feel safe accessing these services?
Yeah, I saw that you used to work at the VA. So PTSD, which is one of the focuses of psychedelics therapy, and also addiction, right? You were involved with that too.
Yes, those were the populations that I most worked with, was PTSD and addiction.
Okay, so let's go back to, do you have a question, Marty?
Yeah, I was going to say, let's go back. So we jumped
let's go back to the training. Let's go back to the training.
Well, I want to even go back further than that if we can.
Okay.
So Dr. Bazinet's got lots of expertise, and she's at the fore of what's happening in the state of Oregon. But Dr. Bazinet, why psychedelics? How did you get involved with this? What has the history been for you in being connected to it? And why do you have the passion to be connected in the way that you are?
Well, that's a big question. I may ramble on for a while, so stop me if I get off topic.
All right.
We will.
Well, so I've been on this ride, and it definitely feels like a ride, since about mid-2016, and that my life has been completely dedicated to being an advocate for psychedelic therapy and kind of showing up just where I am called to show up, which has taken a lot of interesting turns. It started out in 2016. I was up at the VA hospital. I had recently graduated, so I was an early career psychologist. I graduated in 2013, and I had spent a few years at the VA as a postdoc and then a research psychologist, and was really struggling with the lack of resource, the disconnect between the demand for services and the resources that we were able to provide veterans, often veterans who had chronic lifetime PTSD. I was working with a lot of Vietnam veterans and working with trauma. And, the general sort of therapy that we were able to offer them just felt so limited. Mm-hmm. So we often got, 12 to 16 sessions to work with this chronic severe PTSD. And I just felt like, there's got to be something more that we can offer. It was just this sense of something is lacking here.
That you're failing, right?
Yeah, we're failing. Yeah. We're failing to provide veterans with the services that they need after they've, returned and been serving in wars, and they need more than we're able to give them. And I absolutely loved working with the population, but the bureaucracy I struggled with. And then really the turning point, as I feel like I hear so many people say, the turning point was the November 2016 election. And just kind of feeling like I couldn't do it anymore in some way. So I've always been someone who's had a plan for my life. I've always kind of known what my next career step was going to be. It was always well laid out. And suddenly I found myself feeling like this isn't it. Like being a psychologist in the VA system isn't it, but I don't know what is. And around that same time, I discovered about the existence of MAPS, the Multidisciplinary Association for Psychedelic Studies. I hadn't heard of them before. And I learned about their project called the Zendo Project, which is a peer support harm reduction organization of peers that go out to music festivals and events and sit with folks who are having challenging psychedelic experiences. And this really sounded like something I wanted to volunteer for. In my late teens and early 20s, I was very heavily involved in the underground electronic music scene in Seattle, and had spent my life in a lot of subcultures and environments where psychedelics were used. And that was a place where I first kind of healed my own childhood trauma, where I first really discovered that it was okay to express myself authentically, because this was a community that was accepting of multiple ways of expressing. And I had grown up in a very conservative small town in Eastern Washington where it wasn't okay to be who I was. So I found this environment that psychedelics were a big part of to be very healing. And so I went and I volunteered for the Zendo Project. And the moment that I walked into my first festival, it was Lightning in a Bottle, 2016. It just felt like this is home and this is what I'm supposed to do. I can't really describe the feeling of being able to offer just undivided presence and attention for someone who is working through something after taking a psychedelic in a high stress environment like a music festival. And, walking into the Zendo tent, which is this very calm and sort of relaxing space where they have one-on-one attention, and just the response of people of, wait a minute, you're going to be with me through this. I'm on drugs. I did a bad thing. There's a lot of shame with substance use.
Yeah.
And you're going to sit here with me and allow me to just process and express these things that are coming up that I don't know what to do with. And it just felt so powerful and meaningful to me. And I fell in love with the work through that experience. And then from there, of course, learned that MDMA for PTSD was in the phase 2 FDA clinical trial. And that's the moment where it all came for full circle. And I thought, this is what
you found the answer. You found an answer, right?
Well, yes, I thought I did, but more has happened since then. Yes.
So just for our listeners again, in terms of because some people won't know the terms here, the Zendo, it's Zendo project. And then, of course, MAPS is the Multidisciplinary Association for Psychedelic Studies. And really, MAPS is, I don't know, Dr. Bazinet, you'll have to
They're the leaders, right?
With John Hopkins, they're really the leaders of the studies. Would you agree?
Yes, MAPS has specifically focused on MDMA. I mean, other psychedelics as well, but their primary project has been legalizing MDMA specifically for the application with PTSD. through FDA clinical trials. So I believe they were the first to initiate any sort of FDA clinical trial for a psychedelic, at least in recent history. Because as people may know, research was kind of shut down in the 60s and 70s. And MAPS was the first to kind of reignite that. I believe it was 1986 when MAPS started. So it was shortly after MDMA was scheduled, because at the time it was actually used very commonly in therapy, specifically with couples therapy, but other applications as well. And then it found its way into sort of the underground dance music scene and was promptly scheduled. And so MAPS has been attempting to legalize it for therapeutic use since that time.
And then a couple of other things. When you use the language of schedule, for people who don't know, that's the legal term in federal law that makes it illegal to use the substance, the schedule of drugs. And I also want to highlight something here, Dr. Bazinet. You said you worked in the VA. You saw that people weren't getting the therapy they needed. You getting involved with the Zendo project. But I love the language you cited about having undivided attention. The undivided attention of caring for people in the fullness of the experience they were having.
Yes. Yeah. I find that really, really magical. I think that is the ingredient, right? Yeah. And it's the combination of being on a substance that tends to bring about a lot of repressed parts. So it tends to bring out the expression of parts of people that they may typically keep hidden. Because of shame or because of trauma. And so those things are felt and expressed. And so then you have this beautiful opportunity with that undivided attention to witness them in the wholeness of their being and all of these parts that they try to keep hidden from other people. And you're there to witness and give them, full non-judgment of just showing them that it's okay to be all of these parts. And you're here and you're seen and you're loved. That's really what it is.
Yeah. You were talking and I was thinking about the similarities and the differences between what a facilitator would do as to what a mental health like me and Marty, we're counselors, we're therapists, but there's so many similarities, but there is a difference too. And it's tied to what Marty said in terms of you have to give your undivided attention, but also not be as proactive. Right? You have to be more passive because it's their space. You have to respect that it's their space and you just have to be there for whatever they want. But you have to foremost to be there for them, to hold that space for them, but respect that maybe you'll just be there in silent the whole time, right?
That's right. Right. And this is a hotly debated topic right now, especially in Oregon, as we nail down what are the differences between psychotherapy and facilitation, right? And it's, there's a lot of nuance to that. But I think coming back to what you said, Paula, really that letting them sort of lead, right? So sometimes therapists are trained to be a little bit more directive and to work with material that arises for a client, to offer suggestions and to guide the direction of that session. But in work with psychedelics, it's really the opposite. So there's this concept that is typically discussed in work with psychedelics of the inner healer. And so that it means that the client, the idea that there's an inner healer that's really guiding the show. And so the therapist or facilitator's job is really to allow that inner healer to take over and to go with where that inner healer goes. So it is typically more what's referred to as non-directive.
Yes.
In terms of the way that you work with somebody who's having a psychedelic experience.
Yeah. I don't know about you, Marty, but you made me very curious about the discussion because it sounds like it's a heated discussion now. Like there are so many, you said so many nuances. Can you just mention a few?
Yeah. To be quite honest, it's something I'm still working out myself. The language for it. It's like I know what it feels like in an embodied sense, but the language of how to define what is and isn't psychotherapy, what is and isn't facilitation, it's a work in progress. But I will say, that there tends to be this distinction between directive and non-directive, as therapy being directive and work with psychedelics or facilitation being non-directive. I don't personally think it's that black and white. I think, there are examples where somebody may be in a sort of re-traumatization, for example. I'm just throwing out an example, but somebody may be experiencing a trauma and kind of looping on that trauma and just repeating it over and over. Sometimes that can happen with psychedelics where you get kind of stuck on a loop, right? And there are ways that, I mean, this is debatable. Some folks might say, no, you never intervene. But there are times where I feel like it would be doing the person a disservice if I didn't intervene in some way. And those interventions can be very gentle. They can always be, asking the client permission. But it isn't quite so black and white, I don't think, as directive versus non-directive.
Yeah, but even within, we won't go there because that's not the topic, but even within therapy, directive and non-directive, it depends on the approach you have, right? If it's psychoanalysis, that's non-directive. It depends. So anyway, we won't go there. It's a long conversation. It's another episode.
Yes. Yeah. This is something we're actively discussing in the training subcommittee.
So Dr. Bazinet, I'd be interested. You go to the Zendo project, you get some MAPS training. That's 2016 and beyond. We're obviously 2020. In between 2016 and now 2022 that we're in now, what are some experiences you've seen where you've seen the transformative power, or you've seen the insight, or you've seen the difficulty of what happens with people with psilocybin or psychedelics or MDMA? Can you give us a couple of stories, obviously without sharing too much detail, but enough to let us know the perspectives that can be gleaned with this and what can unfold for it?
Yes, it's such a big question. So one thing that I think is important to name is that, each medicine really is different. I know we're in a place where we often refer to them all together, psychedelic assisted therapy and what have you seen in psychedelic assisted therapy. But I really do think that, and this is just a personal opinion, but research might back me up, is that, MDMA for trauma specifically that's where it's at. And psilocybin may be more impactful in chronic depression, end of life anxiety. Folks tend to, this isn't the only mechanism to change, but there is a lot of research to suggest that having a mystical experience or transpersonal experience under the influence of psilocybin can lead to the mechanism of change, of reduction of symptoms. It's interesting. So in the last, how many years has it been? 6 years? 5 years? I can't count right now.
Yeah.
Since 2016.
We're lost in time.
6 years. 6 years.
In time.
I mean, we went into a vortex for a couple of years. So
yeah.
Maybe we're still in it. I'm not sure. I was going to say that it's interesting. I've been doing all of this work in the field of psychedelic therapy, but the only medicine I've been able to work with directly so far is actually ketamine. So, I've been doing a lot of advocacy work and infrastructure building for the legalization of these medicines, but not a lot of direct clinical work. But ketamine is quite powerful in its own right. And initially when I first started working with it, I, had sort of heard that, well, this is what's legal, right? So a lot of therapists come to ketamine because this is what's legal. But I really gained an appreciation for its power in and of itself through that work, that it is quite special in its own right.
So I want to pick up on something. First of all, thanks for highlighting that the different medicines, they're different. They have a sort of different applicability and impact on different people. That's very helpful. I also want to pick up on the fact that you've highlighted that, this is a developing field. We're still learning, and because it's not yet legal outside of the clinical studies, there's yet more to learn and explore. I wonder, and again, I'll lean into your expertise here, but we know quite a bit about the prescribed use of SSRIs. And yet, isn't it still the case that pharmacologists
we still don't
know
anything? Yeah,
so what's interesting is we've been dosing SSRIs for 20 and 30 years now. I don't know exactly, and yet we still don't know exactly how it works. We just know that it works, and I think the same kind of thing is at the forefront of psychedelics. But is that correct? Help me. Is that correct?
Yes, I think that generally that is correct. I think there are a lot of theories, hypotheses about what are the different mechanisms of change. And I think one of the things that's so exciting about psychedelics is it appears that there might be multiple mechanisms of change. It's not really just one, right? So there's, neurophysiological changes that have been observed in sort of brain activity, which is, I think, what we focused on with antidepressants for the most part. But there's also, what I was speaking to earlier of having a mystical or transpersonal experience and the effect that that may have as a mediator of change, as well as just thinking of psychedelics as potentially a catalyst for a therapeutic process, right? There's a lot of focus on the psychedelic itself as the agent of change. But one of the things I think is really lacking in the conversation that I'd like to see us discussing more is that therapeutic container. What does that look like? What is the therapeutic process, and how can psychedelics be used to augment that process?
Okay.
So,
Alissa, I have a question, because we've talked to some, I actually know someone who we're going to interview soon, who is a facilitator. I mean, she's trained in it for ketamine, right? The legal one. But what she tells me is, okay, so a doctor has to prescribe it, and it's up to him or to her whether or not they're going to offer the patient the possibility of having a facilitator. So she was telling me, well, I'm trained, but it's not up to me. The doctors are kind of responsible to indicate that, well, you can have a facilitator and maybe contact me. So it's very passive. And I could tell that she was a little bit frustrated with that. Does the board now, how is the board looking at this in terms of psilocybin? So if you're going to do some kind of therapeutic treatment with psilocybin, will you have to have a facilitator present?
Yeah, so let me back up for a moment, if I may, and answer sort of both parts of what you brought here, because I think it's important. That I think one of the challenges in the field right now is that it is very interdisciplinary. And there are these models where there does need to be a medical prescriber and a therapist working together. And, a lot of folks are building sort of specialized clinics that have all of the different providers in one space. That's one way to do it. But that is, as someone who is actively doing that right now, a lot of work. And so how can we work with the existing infrastructure of healthcare to still make sure that we have those interdisciplinary relationships? Because you're right, at least with ketamine, there does need to be a medical prescriber to prescribe the medicine to the client. There's a lot of different ways that's being done. So some doctors are, working directly with a therapist. So there's a doctor and a therapist in the room with the client. Other prescribers are sending the prescription to the client, who goes and picks it up at a pharmacy and can then take that to their therapist without the doctor being physically on site. So there's a lot of different ways that this is being done, and there isn't really an agreed upon set of best practices yet. We're getting there. So that's the ketamine. And then you asked about psilocybin, and the way that that's being looked at currently, and this could change at any time. And I do want to add that nothing I say is official
final
commentary from the Psilocybin Advisory Board, right? But it is being looked at as completely outside of the medical system. And so the idea is that there would not be a medical doctor involved in the prescription of that psilocybin, that the client would go to the Psilocybin Services site, and whoever is working at that site would have a license to hand them the psilocybin. Now, of course, there's a lot of unanswered questions, such as, is there going to be a dose limitation? How is the dose decided if there's not a medical doctor involved? If the client does have medical conditions, how do we get doctor's advice, right? So there's a lot of challenge that we have not yet figured out in terms of when and how a medical doctor might be involved in the provision of psilocybin services.
Okay, so
does that answer the question?
Yes, but still a few questions, right, regarding that. So
yes,
okay, we have a lot. Oh, sorry. Go.
It does strike me as interesting. Again, correct me if I'm wrong here, but Oregon passed the law and then is trying to figure out how to figure out what the law entails after the fact, but on a timeline. That's the curious thing. All laws have an application stage that emerge after them. But one of the things that I think has been interesting is that it's like within 2 years, get this figured out. Is that correct again?
That's the timeline.
That is correct. Yes.
Yeah, yeah. So we have a lot of therapists that are very curious to know. Some are interested. I want to get the training. Marty wants to get this training. So how is that going to work? Who is going to offer it? How long is it going to be for? Because I know that in 10 months? No, 9 months, it has to be done, right? Because the law, theoretically, you should be able to do it. So we have to get the training soon. So how is that going? Can you give us an overall picture of the training?
Sure. So right now, OHA is finalizing the set of rules and regulations that govern what a training program will need to offer. So that, I believe, should be finalized at the end of May, early June. And so at that point, OHA can begin accepting applications from training programs who meet those criteria. So the draft rules have been released, so you can actually view those on the Oregon, I don't remember the exact URL, but oregon.gov.
We'll have linked
website.
On our notes. Yeah. We'll have it on our notes. Yeah.
So you can view what those draft rules and regulations are. There are a couple of steps before those will be finalized. I believe OHA is about to enter a public feedback session where members of the public can actually write in their suggestions for how they might like to see those rules and regulations be modified. And then there's a couple of other steps, and then those final rules will be released. But there's enough there that training programs have begun to put together their curriculum based on those draft rules and regulations. And so in late May, early June, they can begin applying to OHA to be approved as a program and then accepting students shortly thereafter.
Can you give us an overall of the curriculum? What is involved right now that we know that we would need to learn?
Sure. I believe there's somewhere around 10 modules. I'm not going to get all of them off the top of my head, but what's really exciting about it is the curriculum specifies training in sort of multiple ways of knowing and working with psilocybin. So there will be modules on traditional and indigenous ways of working with psilocybin, as well as more Western scientific ways of knowing and working with psilocybin, the clinical research. There will be a really big focus on ethics, boundaries, trauma-informed care, and then the ways of the different aspects of a protocol. So the administration, the preparation, integration. There may or may not be a requirement for learning about group psilocybin services. I think those are some of the big ones. Cultural and health equity and cultural equity being a really big piece as well. Learning about systems of oppression and how healthcare has played into that.
What about inclusion? Because this is something that me and Marty were talking over the weekend because we were preparing for the interview, but we worry that this is going to be a very expensive program, very long and expensive and not accessible. Do you guys talk about this, and how are we going to tackle that?
We do. We talk about it a lot. I think that there is a lot of concern. I share your concern. That there will just be a lot of pieces that will be expensive for licensure, for the service sites to get licensed, for a facilitator to get licensed. I know there are programs that are offering scholarships, and there is one program in Oregon called the Alma Institute that is focused on training non-licensed facilitators. So these are folks who don't have prior mental health training licensure. And so that will, be aiming to train providers who want to work with BIPOC and LGBTQ populations. So there's some focus on, how to make the training accessible, right? Because a lot of the existing trainings are quite out of reach financially for a lot of people. Yeah. And so I worry as well that at least initially, it will be quite expensive to complete one of these training programs and apply for licensure.
And again, for our listeners, the ALMA training ALMA Institute is available at ALMA, ALMA training.org. So more can be discerned there.
So the timeline is June. You should have the curriculum kind of established. And then I know, and we've seen that some places, some universities, institutions, they're already trying to prepare. And who is going to teach? Because this is so new. who has the knowledge to teach something that's never been done before?
This is another one of those sort of unanswered questions. As somebody who will be faculty for a training program, I feel this strange sense of, what is the saying about building the plane while you're flying it, or something like that? Is that how the saying goes?
Yeah.
Right. So I don't feel like I fully am qualified in some way. I mean, I am, but I'm also not, because this isn't something that's been above ground, right? So there's discussion of how to include trainers and faculty who have been working with the medicine underground for a long time, right? Because they're qualified to teach on these topics. And so how to make sure that they're included in the faculty. It's
tricky, isn't it? It's tricky because you were saying, I mean, we know so many people do this underground. And we were actually talking about this too. So it just doesn't sound fair that they would have to go through a training now. Right. After doing it, some of them have been doing it for decades.
Right, exactly. That's a big topic on both ends. So folks who have been working with the medicine underground for a long time, having to complete a training, folks who do have mental health licenses, going through a training that will include things like empathic presence or trauma, how to work with trauma, right? So those are things that we have training in. One of the recommendations for the OHA that I'm not sure will be official yet, but we've recommended a accelerated hour credit. So for folks who do have prior training, and there's also like psychedelic trainings that have existed, like CIIS or Naropa, right? And so people who have those certificates arguably have some of the skills that will be taught in the psilocybin facilitator programs. So, but training programs, we've recommended that training programs can decide to give students accelerated hours or credit for prior training or also prior experience. So there may be a way to give credit to folks who do have experience.
But that would be up to the institution then. Like we have today, right? Yeah. You come from another university, would they take the credit or not? So it's totally up to them.
Right. Yeah. So that's what we've recommended.
Okay.
I just want to pick up again. Did you say it's in the month of June that the Oregon board will have the parameters of the courses established? Is that the timeline?
I believe so. Late May, early June.
Okay.
Okay. And what about the rest of the country? I mean, where are they? Are they looking at Oregon? I'm sure you have people calling you from all places, but legally speaking, who is moving towards the same thing that Oregon did?
The one that I believe is the closest is Colorado. And I'm not sure exactly where they are in the process, but I know that there have been measures proposed that are very similar to what we've done in Oregon. I had heard that Washington had put together a measure as well, but I'm not sure if that made it through the first initial steps. I'm not really tracking the progress of these other measures so much, but I do know that they're out there, and that, I've seen a lot of decriminalization measures being proposed by multiple states. So I do see that there's been a lot more attention to this issue since Oregon passed 109.
So as we're recording today, it's March of 2022. What would be the things that are sort of happening in the next couple of months, or you anticipate happening in the next couple of months, that people should be aware of, or that you're excited about, or that you anticipate in a good way with the whole spectrum of therapy with psychedelics, and then certainly psilocybin in Oregon? Is there something going on right now that we should know about and be tracking?
Yeah, I mean, I think it's exciting that we're about ready to release that the first draft of the rules and regulations for training programs. So my work on the subcommittee really will sort of slow down after this month. So actually this week is our training subcommittee meeting, and when we finalize the recommendations that we will send over to the full board, and the rest of the subcommittees are doing that as well. So from there, the full board, I believe, has a few meetings to kind of discuss all of the rest of rules and regulations that will govern the program. So there's a lot of things to figure out. And then that will all get worked out, and a final draft will be released in December. So that's when we'll know exactly how the program is going to operate, is in December. If everything goes
Can any clinic today, can anyone apply to be a site? What are the requirements there?
I'm not on that. I'm not involved with those discussions as much, so I'm not going to remember exactly. But there are some specifications around permission of the use of the land, and something around having a physical barrier between sort of the psilocybin service and any other business that exists on the site. So that's something that will be interesting to figure out for existing clinics, because there may need to be a separation between somebody's existing, let's just say it's a psychotherapy clinic, and that existing clinic, and whatever is happening with psilocybin services. So we're going to have to ask you for someone else to be here on our podcast and give us information, because I was just thinking now, how about suppliers? Who's going to supply the psilocybin? Where's that coming from? So there's so many questions. Those are the manufacturer licenses, right?
Yeah. So I would love, to have someone from each of the subcommittees, right? Anything else, Marty?
No, I'm just so thankful. We're trying to discern the therapeutic potential here. And it's a delight to know that there's people that are figuring out the legal side of stuff and the rules side of stuff. And obviously there'll be some hiccups along the way and trying to figure it out. I like knowing that Oregon has the option for people to have input. I think that's going to be so important as we move forward. So I'm really appreciative of hearing that as well.
Yeah.
Yes. Yeah.
Anything else, Alissa? Anything else that you would like to say?
Yes, I was just going to respond and say that I too am very hopeful about the therapeutic potential here. And that's how I got myself into this work. And although I've been, in sort of the more infrastructure building, rules and regulations, systems work for the past couple of years, I'm very, very excited about figuring all of that out and building an infrastructure where therapists can actually begin to work with these medicines with their clients, because I really, really do think that there's a lot of promise here. And having witnessed it firsthand, the kinds of transformations that people are able to make is really just, it's the stuff of therapist dreams. I feel like, you can get there in normal psychotherapy over an extended period of time with a really trusting, strong relationship. And you still need that with psychedelics. This isn't a quick fix. But you can kind of dive deep more quickly and really get through some of that material that might otherwise take years and years to work through. So
we get
I'm really
it.
excited for the day that we figure it out, and that this medicine is actually accessible to the folks who
because we all want to help our patients, right? And we share the frustration, right? Sometimes we go, my goodness, we could do way more than this, but how? So I'm really glad. I'm really glad that we're here. No, we don't.
Because of the mental health, right? Mental health crisis from the pandemic.
Yeah. Alissa, thank you so much for being here with us.
Thank you for having me.
Good to be with you. Thanks for your insight and information. We hope our listeners value it. We hope to have you and others on again. Thanks so much.
Yes, thank you.
Awesome. Thank you both.